Okay.
Cool.
Okay.
It looks
Yeah.
like we're live on YouTube. Cool.
All right.
Very warm welcome to everybody, and particular welcome to Lynn Schulte, who's talking to us from Colorado. And Lynn is running the Birth Healing Summit coming up very soon on the 20th of April. Really looking forward to that. I contributed a little bit to that, and she's got a fabulous lineup of speakers. And today she's going to be talking about some of her work, particularly around pelvic rehab, I think, isn't it? To do with postpartum mums. And she runs the Institute for Birth Healing, using a variety of different approaches to work with mums. So really warm welcome to you, Lynn. Thank you very much.
Thank you, John. Thank you so much for having me. Thank you, Julian. Appreciate having this opportunity. I love any chance I get to talk about this. So I appreciate it.
Fantastic.
Thanks. Welcome. So where do you want to start, Lynn? Do you want to show us some pictures today, or are you going to?
Yeah, I actually have a presentation here that I put together. So if you don't mind, I will just go ahead and share my screen, and you guys can just jump right in. Okay, so ask
Great.
questions as we go. All right. So
Great. Yeah, and if there's any questions from the audience, just put them in the chat room and we'll answer them as well. Thank you.
Awesome. So I've titled this talk Never Ending Birth. These are common postpartum patterns in the body that I've been finding in women. And so I am a women's health physical therapist. I've been a PT for over 30 years, but more than half of that has been working mainly in the women's health arena. And back in 2008 is when I really started working just seeing postpartum women. And I kept seeing the same thing when people would lay down on my table and the pelvis would rotate to the same direction all the time. And every single person I would, that laid down, and I was like, wow, what's going on there? And I figured out that the sacrum did this funky thing after birth, I assumed. And then I figured out how to release it. And then the pelvis would be more level on the table. And these moms would be complaining of low back pain. And in 5 minutes, I would get them out of pain by just manipulating the sacrum and getting it back into a better position, and their pelvis would even out on the table. And so I started putting on YouTube everything I was finding in the postpartum body. That was just one of the patterns I was finding. And then I started getting emails from women all over the world going, oh my God, I have exactly what you're talking about. Would you, can you help me? I'd be like, well, this is only something that I've discovered myself. I didn't really learn it from anyone else. So you could try seeing a women's health PT, you could try seeing a visceral manipulation practitioner. But, yeah, good luck. And so that's when I realized that I needed to start teaching this work so other practitioners could have these techniques in their hands to be able to be more effective with moms. So I founded the Institute for Birth Healing back in 2016, and now I've been traveling the world and teaching other body workers these techniques that are really, really effective in helping moms to heal more completely after birth. So I love this picture here because this is showing all the different motions that the bones of the pelvis need to do in order for a baby to come on out. And so if you look at all the different directions of movements of these bones here, it astounds me. I call this the birth door. This is the door the baby needs to go through in order to come on out. And we do an awesome job in our maternity care for keeping moms healthy and alive and babies healthy and alive. I think we fail in not assessing to make sure that the baby can come on out. And for the majority of women, baby comes on out just fine. But I feel that we're not assessing the birth door. And I would love to kind of increase that awareness of, hey guys, these bones of the pelvis, they need to move in order for baby to come on out. And I had one mom come to see me, and she ended up having a cesarean birth. And so she wanted to do a VBAC. So she came in and her tailbone was sticking straight up like this. And it had zero flexibility, zero movement in there. And I'm like, well, no wonder you ended up having a cesarean, because the tailbone was a roadblock. And she, told me that she had 40 hours of labor. And I was just like, oh my gosh, why didn't anyone check her tailbone? Why are we not assessing this passageway to help make sure that the bones can do what they need to for birth? And one of the biggest components to allowing these bones to move are the pelvic floor muscles. And so in labor, we do a great job of assessing the cervix and seeing how dilated it is. But why not just turn our finger around and check to make sure that the pelvic floor muscles can open up and relax to allow the bones to open up and relax? I've been teaching midwives these techniques, and I've had several of them report back to me that if a labor stalls, they go in and release the pelvic floor muscles, and then baby comes right on out. And so to me, I call the pelvic floor muscles the stoplight for birth. So that if the pelvic floor muscles have too much tension, too much tone in there, and some poor women are taught to doing thousands of Kegels every day during their pregnancy. And it's like, wait a minute, if we're tightening these muscles and tightening and tightening and tightening, we're closing up the outlet. We're not allowing these bones to open up. So we don't want to be doing 1,000 Kegels a day. We want to be doing more to help open up this outlet, which is more about squatting and really letting these bones open up. So that's my soapbox around birth and what we need to be doing prior to birth. I really, if a pregnant person comes to me, there's 3 things that I want to assess: the abdominal tissues and the uterine tissues to make sure baby can get into the best position possible to come on out. I want to assess their pelvic bones and make sure their bones have the mobility to open up for that passageway for the baby. And then I want to assess our pelvic floor muscles and make sure that they have good, nice, even, springy tone, flexible tone, so they can allow the bones to open up as well. So that's the precursor to the whole labor. And I just wish, it's my dream and goal that every woman going into labor would just have those things checked out. Now we know there's a ton more around birth. You know, there's the energetic and the emotional aspects too. And those are things that I teach in my pregnancy course, how to assess for that, how to work with our clients on the energetic, on the emotional level to make sure that their body is just prepared for birth. And so I really hope that those that are in the birth field can just be more aware that we need to assess more physically, is the body able to allow that baby's passage to come on out for birth? So that's my soapbox on pre-birth and preparation for birth. What I'm seeing after birth is that there's this common pattern that happens in the pelvis here afterwards. So this sacrum here, I always find the majority of the time it is shifted off to the right-hand side. So the sacral base is a little bit higher on the right-hand side. And I always like to start all of my sessions, or one of the things I do to assess is I'll just have someone laying on the table and I will just slide my hand underneath that sacrum and just kind of see, where does that sacrum land in my hand? And a lot of times it'll be off to the right. Am I going to the right way? I always get my lefts and rights. That's to the left, so to the right. But that tailbone shifts off to the right-hand side, and it jams up that sacroiliac joint on the right-hand side. And so there's decreased mobility in that right SI joint. And I find that right-sided low back pain tends to be more common in our postpartum clients than left-sided back pain. And I feel that this is part of the reason why. The other thing that happens is the ischial bones, if we go back to this slide here, in order to get the baby in, the ilial bones need to move out to the side, and the sacrum needs to tilt backwards this way. So the sacral base moves backwards, and this helps open up the inlet. To get the baby out, it goes the opposite. And once it hits the pelvic floor muscles, that's when the bones know that it needs to go the opposite direction. And so to get the baby out, the tailbone lifts backwards and then these sit bones come out to the side. So in the postpartum common pattern, sometimes these sit bones are splayed open and left in this position. Okay, so if you can see that the bones, this is what the baby's does in order to come on out. We need this wider opening for the baby to come on out. And what I'm finding is that not everybody comes back together again after birth. Some people are actually left in this open birthing pattern like this. And issues from that is that the pelvic floor muscles attached to these bones in here. So if the pelvic floor muscles, if these bones are splayed apart, those pelvic floor muscles are going to be on stretch. So the pelvic floor muscles aren't going to have the contraction ability when these bones are nice and together in their proper place. Um, People who have their bones open up like this, when we think about the energy of the baby coming on out, if these bones are left open, that energy is still flowing down and out. And to me, this can feel like the faucets turned on full blast and the water's just flowing and there's no containment of that energy. I started asking my moms where I found these bones open in this pattern. I said, so how do you feel? What are you noticing? And a lot of them were two common words I heard over and over was ungrounded and discombobulated. And so to me, there's this lack of containment of their energy and their pelvic space when these bones are still open and that energy is still flowing down and out. And so there's also a greater potential for the pelvic organs not to be as supported when the bones are in this open position here. When the bones are, so if you go to this one and you see these are the bones here, and if they're out to the side here, they're going to put these muscles on stretch. Then this opening for penetration is going to be taut, and it's not going to have the flexibility to allow penetration to happen for intercourse. So some women can complain of pain with intercourse, pain with insertion. And I had one mom who came to see me. Normally when we do this intravaginal work, this vaginal opening is like a circle. And this mom came to see me. She was having pain with intercourse. She said she tore during her birth. The midwife, she did a home birth. The midwife sewed her up, but then she was having pain with intercourse. So she went and saw her OB, and her OB says, oh, you have scar tissue in there. Go see Lynn. And so she came to see me. But when I went to assess this vaginal opening that's supposed to be a circle, it was like this. And so, I put my finger in and I was like, wow, can you feel this? And she could feel all this tension. And all I did was I said, okay, so I'm going to take my finger out. I just brought these ischial bones back together again. And then the flatness became a circle again. And then there was just a little bit of scar tissue here at 7 o'clock. And so it just released that, but that's not what was causing the pelvic floor pain, the pain with intercourse. Those muscles were just like a tightrope in there. And so those bones, helping to bring these bones back together, help soften and shorten these muscles so that they can function better. Also, being in this open pattern here is way more unstable to the pelvis. And so a lot of moms will be complaining about low back pain or pelvic pain somewhere in here. And it's just crazy when you get those bones back together again, their pain they feel so different when they get up off of the table, and they're held together. There's more stability to that pelvic girdle to be able to support them in their body. And the other key piece that we need to be asking our pregnant clients, especially clients who are pregnant for a subsequent pregnancy, if they're dealing with pelvic pain, we need to ask them the question, did you have this pelvic pain during the first pregnancy? And a lot of times the answer is no. If they did not have pelvic pain during that first pregnancy and now they're pregnant again and they start having and now they've got all this pelvic pain, it's because of the birth. The pelvic bones are still in this open birthing pattern, and this is so not a stable foundation for them to live off of. And so with the added hormone pregnancies, it really makes it unstable. And so they develop all this pelvic pain. And moms who see the practitioners who have taken my postpartum course and know how to get them out of this open birthing pattern, in one session, they're better. Their pelvic pain is gone. And so, I say that after a baby comes on out of here, there is no sense of normalcy in the body after having a baby, okay? Because that pelvis has just gotten opened up so wide that sometimes we don't even realize how wide and how open that pelvis still is. Now, some clients will actually report that they just don't feel like they can sit that evenly. And that could be because there's variations of how babies come on out. When I first started working, I always thought the baby's got to come straight on out, right? But that's not what I was finding. So if you look at this picture in the upper left here, this is a normal position of these pelvic bones. These are your ischial bones right here. This is what I want you to focus in on. This can be the open birthing pattern where the babies come on in the midline and both ischiums are still splayed open. But I've also found that the left side ischium can be splayed or the right side ischium can be splayed. And so one of the ischial bones might be more, pushed out to the side than the other. And so my question, and I always wonder, is it because these muscles were more tight on that side that the baby had to come on out this way more? Maybe there was more flexibility to these muscles of the pelvic floor muscles that caused this, or is it the position the mom was in during the labor? So I do know that moms who birth on their sides in side lying, this bottom pelvis is pretty stabilized. It can't move. It's got pressure from the table, from the bed. So this side has to open up more for that baby to come on out. The same thing for a mom or a person who is laboring on their back. If they've got pressure on this sacrum, remember this sacrum needs to move backwards in order for baby to come on out. If there's pressure on this, then this whole pelvis has to lift upward to make room for baby to come on out. So really, birthing on our backs with our legs up in stirrups or being held open is not the most ideal position for the pelvis and for the baby to come on out. And I do find that the most challenging forces on the pelvis is in that side lying position. Because this is anchored, this really has to open up. And so I'm not a huge fan of side lying position just because what I feel happens in the pelvis. But sometimes that side lying position is what the baby needs in order to come on out. So I never try to tell my clients to never do any position. I always say, listen to your body, do what your body wants to do. And it's so important as practitioners for us to understand what position our clients were in when the baby came out, so that we can understand the forces that were imposed on those pelvic bones. And so when we can help bring these pelvic bones back together into the midline, the pelvic floor muscles can react better. They can contract stronger. They can offer more support. So any questions or comments on that, you guys, from what I'm saying?
I was thinking when you do we had a webinar, we're having an assessment series at the moment, and on Zoom, when you're demonstrating those wonderful movements with the actual bony pelvis, it would be good maybe to turn off the
Okay.
But so far it's been fantastic. Yeah, I don't know.
Okay, so do you want me to stop the share and talk about that again?
No, I think it's okay.
No? Okay.
It's just maybe future ones, because that window is so small compared to the slides.
Right.
The slides
Right.
are it's really clear.
Okay. All right. So
Ben, can I just ask you, sorry,
sure.
I'm assuming you're mostly talking about women who've delivered babies vaginally rather than perhaps C-section or whatever. Is that the case?
Yeah.
Or do you find similar things with C-section?
Well, it depends on if they went into labor. I mean, if they went into labor and how far the baby got into the pelvis. So that's what, if your clients come to you and said that, I ended up having a cesarean birth, I always ask the question, well, did you go into labor and how far did you get? And, how far into the pelvis did the baby get? You can, I teach how to really tune in, and you can feel energetically where that energy got stuck, where baby came in, and boom, there should be a flow of energy, especially if there's a birth flow that, needs to come on out. And when someone has been in labor and then they end up having a cesarean, there's a definite stuckness of energy in the pelvis. And you can sometimes tell, like, oh, nope, hardly ever got into the pelvis. No, it got midway and then it got stuck. or, you know, rarely does it come all the way down and then they have to pull the baby on out. So it really depends on how far in that baby got to how much it would affect the pelvis or not.
Yeah, cool. Great.
Yeah.
And that
All right.
hold you showed before where you're cradling the sacrum, that's a common cranial hold. And there's quite a
Yeah.
nice one as well. You can just hold over the ASIS as well, like both sides with your
Uh-huh.
arm, and you can get the feel
Yeah.
of the whole thing then.
Well, John, what I find when I do this, okay, and so I love having this sacrum just land in my hand here, because what I can feel right away is, I call this the lower third of the sacrum right here.
Mhm.
So near the ILAs, so the inferior lateral angles of the sacrum here, this part of the sacrum will just get, it will get so hard and so hammered when a baby got stuck. And you can just feel that in the bone. And that's why I just like to let that sacrum just lay in my hand. The whole body weight is in my hand. And I'm feeling and assessing, how does that tailbone, where does it land in my hand? How does that tailbone and lower third of that sacrum feel in my hand? And that will tell me that the baby really got stuck. So you can see this, that as a baby comes on in, the baby's head will hit and just stay right here. If the sacrum cannot lift out of the way, the baby's head will hit that lower third of the sacrum as it's coming out. And
Uh-huh.
so you can feel that when you just let that sacrum lay in your hand there, and you can just feel that it just gets really hard. And this is something I don't know if there's another term out there, but I started to sense and feel into the bones of the pelvis this hardness. And to me, that hardness is where the bone has been, there's been so much pressure or injury or impact to it. And the bone feels, bone is meant to be a little soft and spongy. It has a give to it. And when a bone has been having too much pressure or forces on it, it becomes really hard. And this is what I'm talking about in that lower sacrum here. It's, if that baby's head was putting a lot of pressure on it, this lower sacrum will get really hard. And so the other thing that I'm going to show you here, oh, one more thing about this variation though, is sometimes, we talked about this doing this and then this doing this, but sometimes I have felt where the actual pelvis has widened top to bottom here. So the PSISs are a big landmark that I palpate. And if the PSISs feel too far apart and they don't have any give to them, that's a sign that this is happening here. And the ischiums are too splayed apart. So the pelvis is just pretty much widened as that baby came on out and hasn't come back together again.
Cool. My colleague Lena Clark, who's a midwife, talks a lot about the sacrum being a bit like a cat flap, and like when you squat, and you can actually feel that if you put your hand in your sacrum, you can feel the whole sacrum kind of moving back as you squat. So
Yes.
do you suggest that a lot for mums and stuff?
Absolutely. So here's the problem, and maybe I will stop screen sharing here just a minute. Don't let me forget to talk about the rami bone, okay? I think it's in my next slide. But so with the sacrum here, in order to help open up, to get baby into the pelvis here, the sacrum needs to move backwards and we need to tuck under. And so many people are actually sitting, when we go to sit, we roll back and we tuck our bottom under. So instead of putting pressure here, we're actually putting pressure on this sacrum and tailbone. Okay. And this is pushing that forward, which actually helps to increase that inlet. But what it doesn't help, and it makes harder for us, is to get this lift backwards. And so this is what we need to be focusing in on. Instead of doing thousands of Kegels, we need to be helping moms to squat, sticking their butt out so that this tailbone lifts backwards. because we're not used to this aspect. Our bottoms, and we're so tucked under, maybe with the way we walk, but definitely with the way we sit. We tend to sit with too much pressure pushing this forward, and it's closing the outlet that the baby needs to come on out. So definitely doing some squatting, sticking the butt out and getting this to lift backwards needs to be the key during pregnancy, and just really helping to open up this outlet so baby has a smoother exit to come on out. Yeah. Great. So let me come back to sharing.
Well, one more
Yeah,
thing, Eileen.
sure.
Just in terms of that, like during like squatting during pregnancy and stuff, do you find though, perhaps if the baby is perhaps, I don't know, back to back or not in a great position, what if they do say squats, maybe the baby can drop down a bit and get a little bit stuck? Is that your experience as well? Nick?
So there are two things. When we are reclined backwards and we have that tailbone tucked under, sometimes we put our feet up on the coffee table or whatever, that is optimal timing for baby to then go back to back. So instead, we really want baby's back to be on mom's belly. But when we're sitting in that reclined position with legs up, that can turn baby for baby's back to be against mom's back. And that is a larger part of the baby's head is going to be coming through. We call that OP, occiput posterior. That means the larger part of baby's head is going to try to come through this, and it's so much more challenging. So we really want baby's back to be towards mom's front, and being on hands and knees is an awesome way to help get baby to rotate. And so I encourage a lot of my moms, get on your hands and knees, lean over a exercise ball on your knees and just kind of hang out there at night. That's one thing that we can do to help get baby into that more back towards the front position to come on out. The other thing is I love the inversion from Spinning Babies, where we actually, if baby is in that OP position, so their face is facing forward instead of backwards, we can get into an inverted position with the butt up in the air, and that will disengage baby from the pelvis. And so you are, your knees are up on a couch and your arms or forearms are down on the ground, your butt up's in the air, and that just helps gravity to pull baby out. And then you want to watch and go to Spinning Babies and learn how to do this correctly. But it's coming up, the way you come up from that position helps to reset the ligaments and everything, and then baby can reset hopefully in a different position. That's something I encourage my moms to do even during the labor process. If baby gets stuck, like, let's get you into inversion and let's try to disengage the head from the pelvis so baby can find a new way of coming in. So important. But keeping moms off of the tailbone, sitting upright, stay at 90 degrees. These are called sit bones for a reason. We need to be sitting on these and not here, especially for birth, because this needs to lift backwards. And if we're putting too much pressure forward, we're closing down the outlet. So super, super important. Cool. Should I go on to my screen share then?
Sure. Lovely. Yeah. Thank you.
Okay. So we were talking about the hardened bone. And one of the things that I find repeatedly in my postpartum clients, another common pattern, is that this left side of the pubic bone, pubic rami, and even ischium here gets more hammered from the way the baby comes on out. So I do an assessment where I compare right side pubic bone, pubic rami, I compare the left side, the right side. And I love doing this to my clients and saying, can you feel how this bone has a little bit of give to it on the right side? And then I, try to do the same thing on the left side. And I go, do you feel how this just doesn't want to move? And they'll be like, yeah. And then bone loves compression. And so I've learned to just compress that pubic bone, pubic rami, and you can just feel the bone just releasing. And then I do it again. And it's like, can you feel how this can move? Now, can you feel how this can move? And there's like, yeah. So we're making changes in the tissue. And I love teaching that to my students, like have your clients feel the restriction, then have them try and feel the release, and then show them how we've gotten more mobility in there. And so it's a really great way to help get their buy-in, like, wow, she's really making changes in the body, or we're really making some difference here. And so this is one of the big things that I find postpartum. And I feel that, I'm like, why the left side? But typically when a baby comes in an ideal positioning, the baby's head, the nose is facing this direction. And so the baby is coming in facing the right side, which means the larger part of that baby's head is coming through on this left side here. So I feel like the baby comes in here and it really just adds more pressure to this pubic rami bone on the left side. And that's why we're noticing a difference in here. One of the big things that clients will complain about with this is adductor tension. So left side adductor tension is really common, and they will go to a massage therapist and get their adductors massaged and say, yeah, it lasted for a day or two. It's because we're not addressing the actual problem, which is the bone. When we have hardened bone, the tissues that attach to it can get activated. And when you release the bone, then you release the muscle, then the muscle can stay happy and stay relaxed afterwards. So these are just all the things that I've just learned over the years and working with the thousands of postpartum women that I have. And they'll come to me and say, yeah, I keep going to massage therapist and it lasts for a day or two. And then I release that bone and release that adductor tension. And then they're like, oh yeah, I'm good now. So, alrighty. Okay, so I'm done with the pelvis. Any other questions on the pelvis before we move to the abdomen?
Have you worked with men with left side adductor tension? I obviously have not had a baby. I have a child, but I did not give birth to our child. And I have left side adductor tension, and I go to a manual therapist to release my adductors, and it lasts a day or two. So I'm just sitting here thinking, are you going to go into how you release the bone, or is with compression and
I'm curious, Julian, if you've had any sort of impact or trauma injury to that left side sit bone or rami bone at all that you're aware of.
I had some motorcycle accidents where I could have maybe have hit the tank in front of me. I slipped on my coccyx jumping off a roof onto a wet floor when I was 13 and had a big knock on my coccyx. But this has developed in the last few years, of which I can't remember any serious accidents in that time.
Well, but that's so interesting because it so can, it just gets held in the bones and in the tissue. And, our body has an amazing way of adapting until it can't anymore. And then we start getting these issues, right? Mm-hmm. And so compressing is, so I would have someone check out your adductor or your pubic rami, or even your ischiums. And so there's several different techniques that I would want you to, would want to check out with you to see. But yeah, if you do find a difference in the bones, then compression of that bone can help it to soften, which can help that bone. In my holistic treatment of the postpartum body course, I teach like 30 different techniques. And one section is all on the pelvic bones and how to release the tension and how to get better mobility in the whole pelvic region. So there's probably 15, 16 techniques just in the pelvic region to how to release that hardness from the bone. So, check that out and have someone check you out too. Okay.
Lynn, there is a question from Giselle, if you don't mind as well.
Sure.
There's a couple of questions here. She says she's a massage therapist and a craniosacral therapist and works with a lot of postpartum mums. And she says, a lot of my patients complained that their right leg felt weaker after delivery. Is there a pattern to that as well?
Well, so with that, I would have to say and I'm going to go back to this right side ischium being splayed is more common than the left. So for whatever reason, and again, so the left side here is getting more hammered, but this right ischium is being splayed more. And so I would have her check to see if she can feel or appreciate, is that right ischium more out to the side than the left side? And can she help bring that in? And she can really help, because this is going to affect, so having this ischium out to the side is going to affect all the pelvic floor muscles on this right side. And the pelvic floor muscles and the hip muscles are intimately connected through the arcuous tendinous ligament in there. So that just helping to bring that ischium back underneath and get those more balanced will help that whole right hip joint too. And there's another technique that I teach in you can get it in both the pregnancy and the postpartum course, but there's a side lying ilial release. I'm going to stop screen sharing so you can see this more. So this bone here, so this is our ilium and this is the ischium. It pretty much is one bone here. But after birth, I have found this bone to be kind of like twisted almost, with just the way the baby came out. There's this interesting little twist to it. And so there's a side lying technique that I teach that helps with this iliobone. So another common complaint is I have a hard time laying on my side, or it hurts. I can't sleep on my side. And I tell you, I do this side lying technique where I'm mobilizing the iliobone in side lying to see if it has good mobility from ASIS to PSIS. And when anyone complains of side lying issues, I do this technique and it goes away. So for hip issues, I would check the ilium. I would also check the ischium. And then of course, also check pelvic floor muscles, because pelvic floor muscles and hip muscles are so intimately connected. Okay.
Cool. There's one more question. Is that right?
Sure.
Yeah. From Deborah. It's about, is it possible that women begin pregnancy with hardened pelvic bones? She says. Absolutely.
And that's why I feel it's so important for us to assess the pelvic bones prior to birth. It's, yes, birth is meant to be normal and a baby is meant to come on out. And that's why, over 67% of the babies do come on out vaginally, and some come out really easily, but some are way more challenging, even though they come out vaginally. And to me, I feel like those hardened bones in this pelvic region from previous falls. I was just asking Julian, like, when have you ever fallen on your buttocks, your tailbone? What about sledding injuries as a baby, as a kid? Those can be in our pelvic bones, and they will impact their ability to move and open up. Now, I didn't say they prevent it. Now, the only thing that will prevent it is that tailbone sticking up in the way and not being able to get out of the way. But I feel that when the bones are hardened, it's just going to make it a little bit more challenging for the baby to come on out. So that's why I always ask with all my pregnancy clients, have you ever had any injuries, impacts, falls on your pelvis? And I had 2 clients I want to share their stories. One mom was an ice hockey player, lived in Minnesota, which is a huge ice hockey state. And she played ice hockey throughout her childhood, and her pelvis was so hard. Every single bone in her pelvis was hard from all of the falls on the ice and everything. And we worked throughout her pregnancy. She was having a lot of pelvic pain throughout her pregnancy because her bones just weren't happy. And that pain and that dysfunction is a sign that things aren't happy in the body. And so we worked throughout her pregnancy and got her as balanced and as released as possible. And she was able to have a vaginal birth. Not to say she wouldn't have had we not done all that work, but I really do feel that doing all that work helped prepare her for a smoother birth. I had another mom who was in the ocean, and a wave hit and she hyperextended her left knee in the ocean when the wave hit. And the impact of it went all the way up into her sacrum on that left side. And it really made this whole sacroiliac joint just really, really hard. And she also was complaining, and her first birth ended up in a cesarean birth. She wasn't able to have a vaginal birth. She tried, but her pelvis just wasn't opening up. And so we worked with her throughout her second pregnancy. And during her second pregnancy, and I don't know if she had this with her first, but she had what we call the irritable uterus. She was having Braxton Hicks 20 to 30 an hour. And on the days that she would see me, her sacrum was so hard and more on this side. And I could feel that jamming up motion from that impact in her leg. And so we released that, got the sacrum more relaxed. And then being on the side of this sacrum here, that hardness, this is where the uterosacral ligament attaches. And so I would release her uterosacral ligament. And on the days that she would come in to see me, her Braxton Hicks would go down to a couple an hour. So it's really interesting, by releasing the sacrum and getting the sacrum happy helps to shift that tension into the uterosacral ligament, which helped the uterus to calm down too. So she was able to have a vaginal birth with her second child because of all the work that she did in freeing up this joint and releasing that tension. So yes, definitely, please check out those bones prior to someone going into labor. And that's what I go into in the pregnancy course, how to do that. So.
Great, thank you. Wonderful.
Awesome. Okay, so let's move on and let's talk a little bit about the belly, because post-birth, do you all know what this is? Diastasis recti. So this is a separation of these recti muscles here. So this is what's considered normal. This is the linea alba here that helps hold these two recti muscles together. And during pregnancy, it is very common for those muscles to have some separation. I think there was a study that says 60 to 70% of all pregnant women develop diastasis during pregnancy. So there is some natural separation that happens. But sometimes there's too much separation, and then it has a hard time coming back together after birth. And so, you know, this isn't true, but my brain really likes to kind of categorize things and put things in boxes. And what I found over the years in working with so many postpartum women is that there is this natural tendency of separation. And if it's under 3 fingers within the first couple of months after birth, it tends to close back up on its own without them really having to do anything. And to me, I like to categorize that's a functional diastasis, right? Because it functionally separated, and then it functionally, when the pressures were gone, it went back together again. Then there's this other side of it where it remains dysfunctional. So there was too much separation, too much strain on these abdominal tissues. And now postpartum, we've got greater than 3 finger separation. We've got a deeper gap in the connective tissue of that linea alba, and they just kind of stay there. And there are 2 techniques that I teach in my courses that I just wish every single postpartum mom could have done to them after birth. And that is releasing these oblique muscles. So you see these side muscles, there's actually 3 layers to our abdominal muscles. The recti muscles are the most superficial. Then we have oblique muscles that come in this direction, and then they go up in this direction. And those oblique muscles help us to twist. And then deeper underneath all those layers is the transverse abdominis that runs front to back. Okay, it's like our girdle. And the oblique muscles, because when you have that big old baby in there, you can't really twist. And so those oblique muscles, they just kind of hang on for dear life, keeping that belly and keeping you upright. So they get really tight postpartum. And can you see how these oblique muscles attach into this rectus sheath? And so if we have tightness in this oblique muscle, it's going to keep those recti muscles separated. And so after birth, if we could just come in and release these oblique muscles and get them lengthened again, that can help those recti muscles to approximate, come back together, and it instantaneously changes the tension in that linea alba when you do this work. And so I just wish everyone could have some oblique release work done. I also teach how to release the recti muscles, because the recti muscles have fascia on all around it. They're kind of like sausages in there. And we need to release the tension around those recti muscles so that this tissue can come back together again. And I teach a class to new moms, and I teach them how to recover their bellies after birth. And I have them come in and I assess and I see how far apart their separation is. And if I get someone who has 3 finger separation and I teach them how to do this oblique release, it goes down to 2 or 1 even sometimes. And there is a significant change in this tension in that linea alba. It actually shortens up, it thickens up instantaneously. And one gal was like, oh my God, that's like magic. And I'm like, it really is. The body is amazing when we figure out some of these key pieces that we can do. It changes tissue instantaneously. And this oblique release and the recti release is one of those. So I think there might be some questions there. John, do you want to see or?
No, I don't think there is any at the moment. No, that's
Okay.
really great. I hadn't thought about that, what you just said. It really makes a lot of sense. Yeah, thank you.
Yeah. And so, it saddens me that so many postpartum clients are walking around with this separation here, and they're doing all the exercises, they're doing everything that they should be doing to heal it, but they're fighting restricted tissue. And if we could just release that tissue to give the muscles the freedom to come back together again, then they can heal so much faster. And so it truly is my goal. And I have a Confidence in Your Core Pelvic Floor and More online course. It's for professionals and moms. And it's everything that I want someone to know about their body and helping to heal diastasis, helping them to heal pelvic organ prolapse, and just how to recover after having a baby. So one of the big things that happens, and I don't have the pictures of it, but post-birth, the transverse abdominis muscle, if you can see my hand here, let's pretend this is your spine. The transverse abdominis muscle wraps around from the spine all the way around like that. So if before birth, your belly was here, and now you got pregnant and it's way out here, then after you get pregnant, it kind of hangs out here more. So do you see how it's just a lengthened muscle? And so the transverse abdominis's job is to stabilize our body, our spine, in order for us to move. And if you're really aware and that muscle is working well, it kicks in ever so slightly before you even go to move. So you lift a leg up, you feel your belly contract. You go to stand up, you feel it just tightens ever so slightly. Well, post-birth, that can get turned off. And that doesn't really happen. And so now there's nothing, that transverse really isn't doing its key job of stabilizing. And so our oblique muscles then kick in, and our oblique muscles' job, they're movers. They're meant to help us to twist. They're not meant to help us to try to stabilize. And so when they do try to stabilize us, because the TA is not doing it, they kick in and it actually causes pressure down. And you can see it in your clients that if you look at their belly, these upper muscles here, and you can see these two mainly will be more pronounced, and this lower belly will be more mush. There will be less form to the recti muscles, the TA, just the lower belly looks mushy, and this is nice and toned. This is a sign that and you can also look at the rib angle. The rib angle, if it's too splayed out or it's too narrow, then they're overusing those muscles too much, which when we go to activate these upper muscles, it puts pressure down on our pelvic organs. So one of the tests that I have all of my postpartum moms do is just put your hand on your lower belly and just cough and see what happens to your belly when you cough. Ideally, it should draw in, but on some people after birth, it's jutting out. Okay. And when it's jutting out, it may be putting too much pressures down on our pelvic organs. And that's going to contribute to pelvic organ prolapse. And we'll talk about that next. But diastasis recti and pelvic organ prolapse is all a postural and pressure issue. So we need to learn how to decrease the pressures on this anterior belly to allow it to heal and come back together again. And so there's a lot that goes into that. And that could be a whole nother topic that we do. But I cover it all in that Confidence in Your Core Pelvic Floor and More course that's online on my website. So you can check that out there. But this diastasis it can be a huge issue for some people. And if we could just release those oblique muscles, release the recti fascia, it really can speed up that healing process.
Lynn, there's a question actually, which I wanted to ask as well from Balin here about the abdominal muscles. What's the pattern you see most in women who have delivered through C-section? Because obviously in C-section, they have to split these muscles.
Right.
So, yeah.
I can't say that there's a typical with cesarean. Yes, we definitely have, and I was going to talk about that further on, about cesarean scar section. We do have scar tissue in those abdominal tissues. And so we need to release that so that they can work better. It's really interesting. And again, I would love to do a study on this, but a lot of times cesarean clients who have had cesarean births, they really need to protect their belly and their movements post-birth because it hurts. And so that actually helps them in the long run, I think, as far as how their core activates. And I haven't studied it enough or closely enough to really see, cesarean births, this always happens. Because I see it whether someone's had a cesarean or whether they've had a vaginal birth. The typical pattern is that lower belly not engaging enough. And so there's a disconnect. So our pelvic floor muscles and our transverse abdominis muscle are wired together. They're meant to contract and work together. And sometimes after birth, that gets disrupted. And so it's our job as clinicians and providers to help educate moms to get them working together again. So whether it's been a cesarean birth or a vaginal birth, that's 50-50. I mean, that's the biggest issue. Okay. So, with cesarean birth, we definitely need to deal with scar tissue, but as far as abdominal function goes, I can't say that there's a typical pattern with it. Okay.
Thanks.
Yeah. So this is something else that we need to be aware of. This isn't as common, but I have had this happen to several of my clients. So this is what happens to when we're pregnant, is that all these organs that used to be down in the belly now get jammed up into the thorax area. And so this dark red object here is your liver, and that normally sits at the edge of your rib cage here. And so with the baby taking up space, those organs getting jammed up, they can get stuck there after birth. So the liver on the right side, the stomach on the left side, and underneath those or on top of those is the diaphragm. So one of the issues that can happen after birth is that women can have difficulty taking a deep breath. And I had one mom who carried twins, and one of the twins was horizontal across her upper belly here. And it was so jamming up into her organs that for 2 years, she was not able to take a deep breath. And when I assessed her, everything was jammed up and stuck in here. And so I helped to bring this down and bring the stomach back down and rebalance and release the diaphragm. And I saw her a couple of days later. She goes, "Oh my God, I can't believe I'm not hyperventilating because I can take a deep breath for the first time in 2 years." And I've had other women reach out to me as like, I can't take a deep breath. I've gone in and I've had the MRI, the CAT scan, they've done all the testing they can, and I still can't take a deep breath. It's because things are still stuck in there. And depending on what the baby uses as its punching or kicking bag, will determine which side got more pressure than the other. And so I love, again, doing another thing I teach in my courses is to just listen to the energy of the tissues on either side of that lower rib cage. So I place a hand here and I place another hand here. And I just feel to see feel for the energy to draw me up Is one of the tissues going up towards the head, or is the other one? And what I love to do is, if I feel it's on like the right side, I'll say, did the baby push a lot on this side for you? And they'll be like, oh my gosh, how did you know? Well, because the tissues are still being affected. The energy of those tissues is still pushing things up towards their head. And those tissues need help coming back down and resettling. So that's for the liver and stomach up here. Once these small intestines, you can see, so those they get up, they could be behind the baby, but they really get tweaked. When the small intestines come back down after the baby is born, I just find the way it settles on top of the uterus and the bladder in that abdominal region is just not always happy. Like there's some restriction in there. And so I like just doing some small intestines release in there to just help it to resettle back in a more friendlier manner with those tissues. So those are, again, some of the techniques that I teach in my postpartum course on what's really needed in the body after birth. All right. This is another thing that I find postpartum is that the bladder, so this red thing here is the bladder, this is the urethra. And what I was trying to have this person demonstrate here in this picture is that the bladder gets shifted off to the left-hand side after birth. And so when I'm doing my intravaginal work, and the way I found this was that I was assessing, I always assess pelvic tone, pelvic muscle tone intravaginally. And I was feeling this tension. There's always more tension on one side, maybe more tender on the other side after birth. There's always an imbalance in there. And so I was feeling that tension and tenderness in there. And then I just got the inkling, like, let's go up and check out the bladder. And when I did, I put my finger on the urethra, and then I reached back in, and you could feel the bladder is just this saggy sack of tissue. And when I tried to feel the space between the left side of the bladder and the vaginal wall, there was hardly any. And then there was all this space over here on the right side. And I'm like, well, that's interesting. Shouldn't the bladder be in the midline? And so then and then I also tuned into the tissue of the bladder, and it like pulled me to the left. So that energetically, that tissue was pulling me to the left. So then I just encouraged it to come back to the midline. And the surprising thing is that after I did that, I went back down and I checked out the pelvic floor muscles, and they were way more relaxed than when I started. So I really see the bladder and even the uterus kind of as the kingpin of this whole vaginal space. That when the bladder is not happy, it's being shifted off to one side. And the cervix, we can find the cervix everywhere after birth. It can be off to the left, to the right, tucked forward, backwards. It's everywhere after birth. And so getting those midline and back into their happier places completely changes the tone in the pelvic floor muscles. And they're able to activate so much better after birth. So I just need, so I've developed this protocol that I teach in my postpartum course. I have an internal course, and then I have an external only course. And so for those that aren't able to do intravaginal work, you can just take the external course and get all the techniques there. Or for those that can do the intravaginal work, you take the internal work, and then you learn the Schulte protocol that I put together, that if you do this protocol in the way that I teach it, it makes getting the pelvic floor muscles to function so much easier, because there really is a hierarchy to the body. And when we follow this hierarchy, it makes our work so much easier. We don't have to force a tissue to release. We can, if you do it in this way, by the time you get to the muscles, there's very little that you have to do to the muscle. And that's what happens when you follow this intravaginal protocol that I teach. And working on the organs is like the first thing that we need to do intravaginally, is get the bladder back into midline, get the cervix moving evenly. And then we can focus in on bringing the muscles all back together again and functioning better intravaginally. All right. So another big issue postpartum is this prolapsing. So this here is a picture in this upper left-hand corner is what normal alignment of all of our pelvic organs looks like. And then postpartum, and this can happen even if you haven't had a baby. Prolapse is a postural issue. It's a pressure issue. So there's too much pressure on these organs, pushing them down and out. And you're more prone to experiencing prolapse after birth because of all that downward force of pushing a baby out. So this is what looks like when you have a cystocele. So this is your bladder coming on out. This is a rectocele. So this is your bowel bulging forward. And then this is a uterine prolapse. And so sometimes you can have pressure, heaviness feeling postpartum, and that can be just those organs are hanging lower than they should be. That's a very common issue. You can just have that heaviness and no other symptoms, and you're dealing with prolapse, or you can also have symptoms here. So with bladder, you could have some leakage, but you could also have some pooling of the urine when you go to empty this. Do you see how this is lower than the opening to let the urine out? So some people who have this issue will wipe and then they'll go to stand up and then they'll leak some more. And that's because we're this lower area here, there's still urine in there. And when you go to stand up, it jostles forward and still comes out. The problem with rectoceles is that you will feel the fullness, like you have to have a bowel movement, but you don't have the ability for it to come on out because it's missed the opening. And what you need to do or have your clients do is actually brace this. They insert their thumb in vaginally and you put pressure on the bowel to push it backwards so that it can come out the opening here. And then uterine prolapse is just more that uterus is sitting lower in that vaginal space and there's more just heaviness with that. It tends to get worse with periods when the uterus is heavier. So we really want to help facilitate and get the energy back up and in and get the organs back into their happy place so that we can offer good support here. And what's important for prolapse for our clients to understand is this pubic bone is our support system. So do you see how the uterus and bladder actually, this is a shelf in this position? And so if you see it here, ideally when we're standing, our pelvis is more in this position. And so the pubic bone is a shelf of support to the bladder and uterus. Post-birth, and this has all been to open up, but if we go and we sit on our tailbone for hours on end, breastfeeding our baby, and then we stand up and we've got our pelvis tucked underneath, this shelf of support is now a slide. And so now these organs are falling off of that support system and don't have the support that they need to stay. So we need to help our clients keep this a shelf and not a slide, all with the positioning of our pelvis. So prolapses are really challenging to work with because it's not a quick fix, and your clients need to understand the intra-abdominal pressures that they're putting on their pelvic organs. And a lot of people, it's habits that they've been doing their whole life that has created this. And a lot of people want to blame the birth, but the birth may just be the straw that broke the camel's back, because a lot of it is the habits and patterns that they've been using their body their whole life that has set them up for dealing with prolapse. So, alrighty. Oh, and then John, here we are, we're talking about that cesarean. So with C-section scarring, this is a cross-sectional view of us. And this red line here is meant to indicate where they cut open the baby. So this is the scar tissue. So uterus was big with baby up here, and they cut the uterus to get the baby out. Well, then it shrinks back down into its space and it creates scar tissue. And we know that scar tissue forms very haphazardly to heal everything and anything in its way. And it can create lots of problems down the road for some of our clients who are really good scarers. Okay, not a good thing when we're dealing with cesareans here. So one of the things is that it can cause bladder frequency because the scar tissue attaches to the bladder and doesn't allow the bladder to expand to hold the urine like it needs to. It'll send signals to the brain as soon as that scar tissue pulls on the bladder, it's saying, oh, I'm full. And your clients will feel like they have to pee every 20 minutes. So when we get in here and we release the scar tissue, it can free things up and let the bladder expand as it needs to. Deep thrusting pain is another issue, and that all these tissues need to be able to mobilize for thrusting. And if this is creating a brick wall there because of that scar tissue, it's going to be hitting, that brick wall, and that'll be that painful ow with deep thrusting. And the third thing that can happen is there's low back pain. So we have those two uterosacral ligaments that come back and attach to the sacrum back here. And I've never met a C-section scar. Have you, John, that is not tighter on one side than the other? So, so I find it's usually with the side the surgeon stood on and is tighter. And then that's going to torque that uterus a bit, and the body protects the organs. So then it's going to pull on that sacrum, and the sacrum's not going to be able to mobilize it and move as it needs to. So when you do scar tissue release work, you can help save your clients from those three issues. And we got to get in there. I talk about it. I have a video on YouTube on how to massage your C-section scar. And I just break it into three, skin, muscle, organ. And the organ layer is the most important layer. We need to get down and make sure that these tissues can move and free up from themselves. I also like to do it intravaginally too. I feel a big difference in this connection of the tissue from bladder to uterus intravaginally when they've had a C-section scar. I've also been very surprised to find that women who have had C-sections also may have penetration pain. And the pelvic floor muscles down here at the bottom are the opposite end of this tube here. So when this has been pulled and traction from pulling the baby on out, it affects these tissues down at the other opening. So we need to help release both of those in order for moms to be happy there. So that's cesarean there. And that's everything that I wanted to cover. I just wanted to share real quickly about some of the things that we offer with the Institute. We do offer one-on-one sessions here in Denver, Boulder, Colorado area. We have online classes for mom. I talked about the confidence in your core, pelvic floor, and more. And we also have a simpler steps for smoother birth and a faster recovery course. We have online courses for body workers, doulas, and midwives. And we also have a certification program. So we have a doula course that is CEU'd through DONA, facilitating a smoother birth and faster recovery. So that's to help doulas help their moms. We have a course for midwives. That's a holistic treatment to facilitate labor and postpartum recovery. So this is specifically for midwives. And then we have courses for body workers. This is our holistic treatment of the pregnant body, holistic treatment of the postpartum body. Both of those are offered live and in person and online. And through the month of April, this month, we have lowered our prices to these online courses. You can save $200 off of the pregnancy or postpartum course individually, or we can bundle both of those together for $997, which saves you over $600 on those courses. So if you're interested in that, please go to our website and check that out. We also have an advanced treatment of the postpartum body course, which dives more into the energetic and emotional healing that needs to happen with trauma and everything after birth. We dive into it, and it really is designed to help the clinicians to learn how to do this work with their clients, but it really is designed to help you work on yourself and clear your stuff, your issues, so that you can show up more powerfully for your clients. I truly believe that if, as healers, as body workers, we need to be as grounded and present as possible, and we can better serve our clients that way. And that's what the advanced treatment of the postpartum body course really is all about. It's looking at your own stuff, where you're blocked, where you're holding yourself back, and releasing those so you can show up more powerfully for your clients. So we also offer certification to become a birth healing specialist. By taking those three courses, the pregnancy, postpartum, and the advanced course, there's also some testing and other steps that you need to do, but you will become certified through the Institute for Birth Healing. We'll give you this nice little seal that you can place on your website, social media, and we do a lot of promotion of our certified practitioners. We have a directory on our website of all the practitioners that we have trained, and our certifieds get top billing in that directory. And those are the people that I refer clients to that are reaching out, wanting help. I have them go to my certified trained people first. So please, please become involved with the Institute for Birth Healing. We would love your support. We would love to support you. We do host birth healing summits. John was interviewed for this year's summit that's happening April 20th through 29th of this year, 2020. We do them every year. Every April, we hold a birth healing summit. I interview experts all over the world, all around postpartum healing. It's an excellent event, so fun. People really love it. We also have a channel on YouTube. Would love for you. We've got over 30 videos on that. We also have a private Facebook group, Institute for Birth Healing Community. I do Facebook Lives in there, and lots of topics and discussions going on there. So please become involved with us. And I just want to thank you so much for having me.
Oh, thanks so much, Lynn. That was wonderful. Gosh, amazing.
That was a lot, I know.
Well, gosh, so much information. That's just fantastic. Really fantastic. So thank you so much. And I'm looking forward to the summit on the 20th. That'd be great.
Yeah.
So that's birthhealingsummit.com, isn't it? Yeah.
Yes. Yes.
Fantastic.
So please
Wonderful.
check that out.
Will do.
You.
Thanks
Awesome.
so much, Lynn. That's really wonderful. Thank you.
Thank you, everybody, for listening in. So appreciate it. Thanks, John. Thanks, Jillian.
Bye.
Bye.
Bye-bye.
Bye.